So directly going into the topic without wasting time. So breastfeeding in various maternal conditions. So starting with the WHO on this week of 2023, the logo this year is "Let us make breastfeeding at work." Work means so exclusive breastfeeding. The goal of exclusive breastfeeding is not being completely attained, or the partial attainment of this breastfeeding, exclusive breastfeeding, is mainly due to that working mothers nowadays. So the percentage of working mothers are increasing, and due to that tight work schedule, it is hampering that exclusive breastfeeding for the first 6 months. So in view of that maternal workload, WHO has pointed out that breastfeeding at work, let it work out. So it should be like some steps being advised by WHO to promote this exclusive breastfeeding. So that even WHO is having an outlook that the lady should be educated well before birth of the baby to encourage exclusive breastfeeding. The same outlook has been advised by our Acharya, saying that we should start from the breast care even when the lady is pregnant. So WHO is now putting having the outlook that trained health workers providing breastfeeding counseling during pregnancy, at birth, and for the next 2 years, so that the baby should enjoy, and baby should be having the right to enjoy that exclusive breastfeeding. And something should be a paid time, paid working hours for the ladies who is nutritious to that lady. So many a times this financial crisis which is happening to that pregnant, to that lactating mother, is preventing her from exclusive breastfeeding or spending that much time with the baby. So in a scenario of increasing cognitive behavioral disorders, so we should think twice, not only in the exclusive breastfeeding, but spending enough time with the baby. Having a good mother-baby rapport is very important in shaping the behavior of. So nitya abhyasa, one among that Bhavas as told by Charaka. And investment in breast milk. Am I audible, ma'am?
Yes, ma'am. Participants, please unmute your mic. Mute your mic. Participant, I think Dr. Changle sir, mic is going on. Please mute your mic.
So thank you. So we have to invest in breastfeeding support programs as well. So CME is like this. It's a novel venture.
Madam, unmute.
Am I audible, ma'am?
Yes, ma'am. Yes. Yes.
So this CME is like this. It's a novel venture to promote breastfeeding or making the health professionals more aware of the importance of breastfeeding and making them more aware of the steps that should be taken to promote exclusive breastfeeding. So what are the usual problematic areas when coming to exclusive breastfeeding? That misconcept about the colostrum. So colostrum is not similar to breast milk, which is white in color or not having the consistency of breast milk. So it's a widespread belief that colostrum, whether it's to be avoided or not, even our texts have our classical text having a different outlook regarding breastfeeding colostrum. But when we go into detail, Acharyas has said that prak nishitta stanyasya asyao means baby is not getting the breast milk. That is why we have to get a supplement. It's not that breast milk or colostrum should be avoided. Colostrum is mandatory, and that is why it is included under Jata Karma Parichaya Samskara itself. The initiation of breast milk should be as early as possible. So, including the colostrum in the breastfeeding or not avoiding the colostrum, recognizing the benefits of colostrum feeding is also important. And breast milk should not be viewed in the point of nutritional aspects alone. The mother-baby bonding, which is developed through this breastfeeding, is exclusive. It happens only when the mother is feeding the baby through the breast alone. And express breast milk is never a compensation for this breastfeeding. So that's also another thing. Someone will be telling that my baby was on breastfed, but I couldn't feed it directly. I was expressing the milk and then feeding. But it should be noted that it is never going to replace that direct bonding which happens in the direct breastfeeding. So that importance should be also laid for mother-baby bonding in direct breastfeeding, and express breast milk or EBM is never a compensation for that. And one more point to add is the importance of establishing a gut flora. The intestinal gut flora of the baby is going to establish in the first 2 years. Akni Moolam Belam Pumsam. Actually, the concept of Akni laid by the Acharyas is not equated to any digestive juices or intestinal juices or anything. The concept of Akni is in toto includes that concept of intestinal gut bacteria or intestinal gut microbiome as well. So in due course of our talk, we will be talking about that influence of breast milk in shaping the gut flora. Another point is that this mother is supplying the baby with all sorts of antibodies to make that baby protected against all infections which are the baby is going to expose. So an enormous amount of antibodies which is given to the baby is through the breast milk alone. So it's a power bank of immunoglobulins. And the final point is that the more you feed the baby, the more you lactate. I need to stress this point because many ladies, especially working ladies, are coming to our OPD complaining that they're having insufficiency of breast milk. Madam, I am not able to satisfy the needs of the baby, so I need something else. This is a usual complaint. So the one and only sentence we should advise is, more you feed, you try, be happy, have a feeding, more frequency of feeds will help you lactate more. So more you feed, more you lactate. These are 5 important points we need to discuss in this breastfeeding schedule. So to define with, breastfeeding is a feeding of an infant with breast directly with breast milk from the direct female human breast via lactation. In turn, I'm trying to stress that it's not EBM. It's not supplementing the baby with express breast milk through tube feeds or pallida feeds. Should be promoted to suckle the breast directly. Why we should emphasize on breastfeeding? Because 25% of ladies are not initiating the breastfeeding in the first 24 hours. And surprisingly, you should know that 50% of the ladies are discarding this valuable elixir of life, the colostrum. And 75% of women are giving pre-lacteal feeds in a view that they are having a deep breast milk insufficiency, in a view that baby is not getting satisfied. So we should work against all this. The early initiation, including the colostrum and cutting off the pre-lacteal feeds. I want to just give a sketch of the benefits of breast milk. Why? Because why it is different from other milk. The breast milk contains the protein load which is easily digestible by the baby. The proportion of whey protein and the casein protein is very unique in breast milk, and it's not similar to the cow's milk. The protein load of cow's milk is very high, and actually the cow's milk is actually suit for the growth of the baby cow alone, calf alone. It's not suit for our babies. Why? Because our protein ratio, that is whey protein to casein protein, that 60-40 ratio, is suited for the digestion of our babies, human babies. That's why we need to be breastfed on the maternal milk alone. That's why Acharya important that the lady is not lactating well. Think of a datri. And even if you are not getting a datri, then only think for a substitute for the breast. So every time human milk is the best equivalent for breast milk. And it has a, as I told earlier, it has a treasure of immunoglobulins supplied by the mother. Secretory IgA is going to protect the baby from all the viral and bacterial infections which the baby is prone to. And a special protection against Escherichia coli, E. coli, and all possible allergic disorders. We are facing now many atopic disorders like atopic dermatitis, atopic rhinitis, atopic bronchial asthma, everything nowadays. The increasing trends with increasing pollution and all. So breast milk is having a innate defense mechanism against these allergic diseases, and a treasure of immunoglobulins IgG and IgM. Again, the bifidus factor in the breast milk is supporting the rich growth of healthy microbiota in the human coli, the baby's gut. Lactobacillus is supposed to be the most healthiest form of bacteria, which is supposed to fulfill that gut flora. The thick flora of lactobacillus has a capacity to curtail the overgrowth of other unhealthy bacteria as well. So this bifidus factor alone is going to support this excess or healthy growth of lactobacillus in the human gut. And apart from this bifidus factor is going to create an acidic environment which can curtail the excess growth of harmful bacteria as well. Another thing is that lactoferrin in the breast milk is going to inhibit the growth of iron-dependent bacteria in the human gut. So certain bacteria in the human gut will absorb or utilize the iron from these babies, and they grow and replenish. So this lactoferrin is going to curtail that excess pruning of this iron-dependent bacteria. Again, that lysozyme of the breast milk is going to curtail the overgrowth of E. coli and even the salmonella. Salmonella typhi, which is responsible for the typhoid fever. So it again restricted by lysozyme. And again, promotes the growth of healthy intestinal flora and also helps in anti-inflammatory functions. And another part is regarding the fat. The long-chain fatty acids of the human breast milk, especially they contain polyunsaturated fatty acid. We can call them as PUFA. This polyunsaturated fatty acid has a special power to trigger the neuronal development. So studies have showed that babies on exclusive breastfeeding is having more IQ or intellect quotient or cognitive capacity than those who are not on exclusive breastfeeding. This single point is enough to highlight the importance of breast milk in coming years, because every parent is eager to have a baby with good IQ and good EQ. So the brain, retina, and your nervous system development is triggered by this PUFA. And the vitamin load in the breast milk is actually proportionate to the vitamin intake of the ladies. So that's why we are giving much importance to the pregnancy or lactating health care of this lactating lady. So if the diet of the lady is so adjusted that it is vitamin rich, this vitamin is going to travel to the baby through the breast milk. Again, coming to carbohydrate. The lactose in the breast milk is going to decrease the unhealthy bacteria in the gut and improve the absorption of calcium, phosphorus, and magnesium in the food or from the breast milk. And again, another point is that many lifestyle disorders like diabetes, bronchial asthma, eczema, liver disease, everything has a protection additional protection for an exclusive breastfed baby. So, lowering the risk of socio-behavioral problems of the life as well through this bonding which happens in the mother-baby unit. Otherwise, baby was completely dependent on the mother in the womb, and one fine morning, if the lady is not going to breastfeed the baby will be completely separated and will be left alone. So, comfort or that kangaroo care that lady is going to provide is not only nutritional, it's going to shape that behavioral axis of the baby as well. So coming to that importance of gut microbiome in the baby. So as I told earlier, that gut microbiome is going to decide before the age of 2 or 3 years. So how healthy your gut microbiome is having a crucial decision in the early years. And the major point attributing the decision of gut microbiome is by the feeding schedule. Other things which happens in utero and the delivery process, gestational age cannot be much altered according to our will, because we try to have a good gestational maturity and try to have a normal vaginal delivery, but it doesn't always happen. So many other factors are there influencing the gestational age and even the mode of delivery. But we have the 100% power to decide whether we are going to have an exclusive breastfeeding or not. So the quantity and quality of the breastfeeding, I will stress that point once more. The quantity and quality of breastfeeding is going to decide that health status of the baby's gut microbiome. Because if the lady is having a Shuddha Stanya, devoid of other Vada Paitya Kapha Dushtis, the lady's breast milk is very easily digestible for the baby, because it's an Upadhatu of that rasa itself, going to help the baby to assimilate well. So baby is going to have a good digestive and metabolic power. So there won't be any chances of amatwa in the baby. So the chances of having a good microbiome is chance of having a healthy microbiome is more in babies consuming a Shuddha Stanya. But it is sad to say that we had a prevalent study conducted in our department, and we came to know that the ladies, maybe belong to Kerala, and it's an Anupadesha. A study conducted in our department showed that 97% of lactating ladies are having an Ashuddha Stanya. And it's sad to say that we could find the Shuddha Stanya Lakshana in only less than 3%. So the study was conducted as a part of a research study, and the trial drug was Padadi Mahakashayam. And it was shown that the Padadi Mahaushadha Yoga was very effective in reducing the Dushta Stanya Lakshanas and reinstating the Shuddha Stanya Lakshanas. So I would like to stress the importance of Shuddha Stanya and quality and quantity wise of Shuddha Stanya in shaping a good healthy microbiome. As I told earlier, the Shuddha Stanya is going to promote the health of good or healthy bacterial flora like Lactobacillus, Enterococcus, and Bifidus bacterium in that. And it is going to restrict or curtail the growth of unhealthy bacteria like Staphylococcus, Streptococcus, E. coli, Clostridium, and even Klebsiella. So it is like a barrier, or it's like a guarding protection for the baby to create a healthy gut, which is going to serve as that base of acne for the further life as well. So directly coming into the topic, now I'm going to explain the common breastfeeding problems which a lady encounters during the breastfeeding period. And the first is a low milk supply. As I told earlier, Many of the ladies will be presenting or complaining to the OP that, madam, I am not having that sufficient breast milk to feed the or to satisfy the baby. Baby is crying at night. So it's a horror time for me. So help me with some other supplements. So low milk supply by the ladies is a major complaint which we come across. And the next comes the cracked nipples, because the nipples are not being cared properly before that or during that pregnancy time. So cracked nipples, as soon as the baby starts suckling, it gets cracked. So next comes the mastitis or engorged breast. Usually happens in the early days of lactation, when the lactiferous ducts are not being that cleared off. Next comes that fatigue, that delivery fatigue or something happens. The lady is so tired to feed the baby. And the next most important is one, infections coming to that lady. When the lady is having a viral fever or any fever, lady will be suspicious whether I should feed the baby or not. Usually it's a practice is like curtailing the breast milk. So in a possibility to prevent that spread of infection from the mother to the baby. So usually without seeking for a medical help, these ladies will usually curtail the breastfeeding as soon as the lady get infected, as soon as the lady has a fear or any disease. So that's not a healthy way. So intention of our paper is to check which all diseases we should avoid, we should be cautious, and what all precautionary measures we should take to avoid spread of this infection from the lady.